the Haematology station. A little bit weird, a little bit different, but today we're going to talk through what you need to make sure you pass with flying colours. Peace and blessings, YouTube family. Today we're going to talk about the Haematology station. This is one of the stations that can come up and is classified as the other examination scenario, but it is essentially a generalized top-to-toe examination of a child. So, step one, always start with the acronym WIPER. Wash your hands. Introduce yourself to the patient and inspect your surroundings. Ask the patient if they're in any pain and ask permission to conduct the examination. Ensure the patient is adequately exposed so that you can undertake your examination well and slickly. And reposition the patient so that the patient is at a 45-degree angle on the chair. Next, look for any overall features of dysmorphism. Next, move on to the face and inspect it for any pallor, any jaundice. Make a mental note about the ethnicity of the child, because this may be useful in distinguishing certain conditions in your differential diagnosis. And also comment on the growth of the child, whether the child looks particularly cachectic. Then you can move on to the upper limb, again inspecting for koinonychia, so any spoon-shaped nails indicative of iron deficiency anemia. Look for any evidence of clubbing, which you can also do with the Shamroth sign, and you can ask children to demonstrate that for you by asking them to put their fingers up, put their fingers down, put their fingers together, and then you can inspect. You would also palpate the radial pulse and also ask for the blood pressure. The blood pressure will give you an indication of whether this child may have a neuroblastoma, which may be catecholamine secreting. Inspect the child looking at their face, looking at their growth, whether they look particularly cachectic, is there an element of pallor, is there any jaundice, and make a mental note about the ethnicity of the child. This may be important in delineating differential diagnoses once you are at the end of your examination. Next, inspect the head and neck. You're looking for frontal bossing, which is a sign of extramedullary hematopoiesis. You're looking for malar prominence, which can be in certain cachectic conditions. You also might get glossitis, again indicative of chronic B12 deficiency. And also checking for conjunctival pallor and scleral jaundice. Next, you should ask the child to remove their top, inspect their chest, looking for any central venous lines. Then you should comment on their work of breathing, palpate their cervical and supraclavicular lymph nodes, and also their axillary lymph nodes, and have a listen for any murmurs. Next, you inspect the abdomen, in which you're looking for any scars that they may have, indicative of previous surgery. If they have any bruises at injection sites, for example, if they have to inject themselves with anticoagulation medications, or if they are taking factor 8 for factor 8 deficiencies. And finally, you should palpate and percuss for hepatosplenomegaly. Again, starting in the right iliac fossa, palpating up until you can feel the edges of the liver on the right, the spleen on the left, and percussing until you can hear the change in dullness at the lower edge of the liver, then at the upper edge of the liver, and the lower edge of the spleen. Finally, you should check the legs for any evidence of infection, bruises, and arthropathy. And that completes your examination. So you thank the parent and relative, you turn to the examiner, and you say, "I would like to complete my examination by checking the height and weight of the child and plotting it on an appropriate growth chart, checking whether the child has any fever, checking the inguinal areas for any lymphadenopathy, checking the testes in boys for any testicular cancers, and in an Afro-Caribbean ethnicity where sickle cell is suspected, undertaking a full neurological examination to make sure that we do not miss a stroke. The cases that could be presented to you as part of this station are mainly purpura, jaundice, and hepatosplenomegaly. And for a detailed breakdown of these cases, please visit my free MRCPCH Clinicals Guide, which I've linked in the description below. At the end of the examination, the examiner will ask you 2 questions. The first question is, what investigations will you do for this child? Investigations can always be broken down into bedside, blood tests, imaging, and others. Bedside tests would include height and weight on the appropriate growth chart, taking a full history, and a full set of observations. The blood tests that we should do on this child include urea and electrolytes for kidney function, liver function tests, a full blood count including blood film, HB electrophoresis, potentially clotting studies, and von Willebrand factor and riscotine. Any imaging that may need to be done on this child would likely include an ultrasound of the abdomen to see whether there are any obvious causes of liver or spleen dysfunction. The second question the examiner will ask you is, how would you like to manage this child? Management is always broken down into 4 categories: acute, chronic, multidisciplinary team, school and social, and family. An acute plan would always include an A to E assessment of the child, giving the child any pain relief, any oxygen that they need, any fluids, antibiotics, and potentially transfusion. Chronic management would include the multidisciplinary team, which consists of the pediatric hematologist, the local pediatrician, the specialist nurses, the dietitian, and for extra brownie points, mentioning open access to the pediatric ward. For those of you that don't know, open access is a scheme in the UK where children with chronic conditions can attend their local hospital and have a paediatrician give them advice, examine them, and change their management. School and social planning. So every child with a chronic health condition can benefit from an educational healthcare plan, which will include and also benefit from a social worker undertaking a financial needs assessment on the family, so that the family can get the financial support that they need. And finally, managing the family. It's important for them to have a leaflet on the condition that the child has. Also, they should be told the red flag symptoms which they should look for, in which case their child would need to come back to the hospital. And they should also be given some information about parent support groups online. My personal favourite is contactafamily.org because it's completely user-led, user-referred, and it connects families that have children with the same medical problem. So there you have it, the Haematology station demystified. So please do like, comment, share and subscribe. So please do like, comment, share and subscribe for more videos. This has been the Baby Doctor. Peace and blessings.